Goodpasture syndrome, also known as anti-GBM, glomerular basement membrane disease, is a rare autoimmune disorder that primarily affects the kidneys and lungs. It is caused by the production of autoantibodies, antibodies that attack the body's own tissues, against a specific type of collagen in the basement membrane of the glomeruli, tiny blood vessels in the kidneys, and the alveoli, air sacs in the lungs. The pathophysiology of Goodpasture syndrome involves the production of autoantibodies against the alpha-3 chain of type 4 collagen, which is a major component of the glomerular basement membrane (GBM) in the kidneys and the alveolar basement membrane in the lungs. These autoantibodies bind to the GBM and activate complement, which leads to the formation of membrane attack complexes (MAC) that damage the basement membrane and trigger an inflammatory response. The exact cause of Goodpasture syndrome is unknown, but it is believed to be triggered by a combination of genetic and environmental factors. Smoking has been identified as a significant risk factor for the development of Goodpasture syndrome. The symptoms of Goodpasture syndrome usually start with respiratory symptoms such as cough, shortness of breath, and chest pain. As the disease progresses, it can lead to kidney damage and cause symptoms such as proteinuria, excess protein in the urine, hematuria, blood in the urine, and decreased urine output. If left untreated, Goodpasture syndrome can cause irreversible kidney damage and even kidney failure. The pathophysiology of Goodpasture syndrome involves the production of autoantibodies against the alpha-3 chain of type 4 collagen, which is a major component of the glomerular basement membrane (GBM) in the kidneys and the alveolar basement membrane in the lungs. These autoantibodies bind to the GBM and activate complement, which leads to the formation of membrane attack complexes (MAC) that damage the basement membrane and trigger an inflammatory response. Diagnosis of Goodpasture syndrome involves blood and urine tests to detect the presence of anti-GBM antibodies, as well as imaging studies such as chest X-rays or CT scans to evaluate lung involvement. If anti-GBM antibodies are absent and patients have evidence of glomerulonephritis, hematuria, proteinuria, red cell casts detected with urinalysis, renal insufficiency, or a combination of these findings, a renal biopsy is indicated to confirm the diagnosis. Treatment for Goodpasture syndrome typically involves a combination of immunosuppressive drugs, such as corticosteroids and cyclophosphamide, to suppress the immune system and reduce inflammation. Plasma exchange, a procedure in which the patient's blood is filtered to remove harmful antibodies, may also be used in severe cases. In some cases, dialysis or kidney transplantation may be necessary if the kidneys are severely damaged. The prognosis of Goodpasture syndrome can vary depending on the severity of the disease, the extent of organ damage, and the promptness and effectiveness of treatment. If the disease is not treated promptly, it can lead to irreversible organ damage and potentially life-threatening complications. Kidney failure is a common complication of Goodpasture syndrome, and some patients may require dialysis or kidney transplantation to manage their kidney disease. The overall 5-year survival rate for Goodpasture syndrome is approximately 75 to 80%, but this can vary depending on the severity of the disease and the patient's response to treatment. Goodpasture syndrome is a serious condition that requires prompt diagnosis and treatment to prevent irreversible organ damage. With appropriate treatment, many patients with Goodpasture syndrome can achieve remission and lead normal lives.